Hi everybody and welcome back. Today I'm going to show you how to interpret a SIBO breath test, and particularly I'm going to be focusing on the Trio Smart breath test. Now for those of you who don't know, or maybe you're not in the United States, this is brand new, hot off the press. It's only been available for about 6 months, and this is the first and only breath test that measures hydrogen sulfide, the elusive third SIBO gas. So if you have been wondering if you have hydrogen sulfide SIBO and that's been tossed around or suggested to you, this is the test that you might want to consider. But I do find that the interpretation of SIBO breath testing overall and the Trio Smart test in particular can be a little bit unclear, shall we say. And I want to lead you through how I go about interpreting these, and I'm going to show you a whole ton of different examples of what this test can look like. And spoiler alert, what I have found is that hydrogen sulfide SIBO is not nearly as common as we thought it was, in my opinion. I mean, the company would tell you else otherwise, but I'm going to get into that a little bit throughout the video. So hang tight and we're going to go over this. So you can see on my screen that I pulled up one of the SIBO tests and I've blacked out or I've whited out all of my patient information. So this is totally HIPAA kosher. But the first thing you want to do when you're looking at interpreting a SIBO test is there's two initial steps. First, you want to look at what the substrate was or what the sugar was in order to test for SIBO. So you can see in this case, this was a lactulose breath test. Lactulose does have lower sensitivity and specificity than glucose, so it is going to result in more false negatives and false positives. But the thing is, you'll see a lot of the tests that I run still end up being lactulose, because I find that giving people that high of a dose of glucose all at once can make people feel really crummy, especially if they have any predilection towards blood sugar issues or candida overgrowth. So I end up selecting lactulose a fair amount of the time just because I don't want to throw people's blood sugar into a total and complete loop. And I know because I did that to myself when I did a SIBO breath test using glucose. So first things first though, you look at lactulose. And the thing you need to know about lactulose is that it's going to result in more false negatives and false positives. And the primary reason for that is that it is known to speed up orocecal transit time. That is the amount of time it takes something to reach your cecum, the very beginning of your colon, from your mouth. It was studied for that for many, many years prior to becoming a SIBO breath test substrate. And in honesty, lactulose is not used for SIBO breath testing outside of the United States, hardly at all. Really, other countries utilize glucose far more than lactulose. But you want to look at that because it will speed up the transit time a little bit. And then you can also come down here and you just want to make sure that all of the samples have something here. So you can see sample 1 down in here. I wonder if I can highlight my cursor. Hold on, let me see if that's a thing I can do here. No, but I can draw. So you can see down here, sample 1 is right here, and you can see there are quantifiable numbers for all three of those. Sample number 2 is right here, and you can go down the line and look, and there are quantifiable numbers. There's no invalid samples anywhere on here. Then you can come up here next and you can see where the lab has its cutoff. Now, Trio Smart uses some pretty peculiar cutoff points, but you can see, give or take, about 20 parts per million for hydrogen, 10 parts per million for methane, and 5 parts per million for hydrogen sulfide. And they will give you their interpretation both here, where they say normal on this sample, and they will usually give you some sort of interpretation down here. But that's going to be taken with a very large grain of salt, and I'll show you why in subsequent parts of the video. But let me go ahead and scroll down. And you can see this is actually a perfectly normal negative SIBO breath test. You can see that the bacterial fermentation, the hydrogen level stays well below 20 parts per million, right up until about the 90-minute mark. You can see that this person did their 90-minute sample at, it looks like 93 minutes. So they did one at 78 and one at 93. And you can see that right there, they were just barely passing the 20 parts per million threshold. Now, here's the thing though, is that remember, this is a lactulose test. Lactulose speeds up transit time. So anything around this 90-minute mark is questionable. Even if it's on this side of the line here, it's still kind of questionable because lactulose can speed up your transit time by a lot. So I would call this a negative SIBO breath test because it looks like they're just barely passing the 20 parts per million mark at the very tail end of this. And then you can see a nice clear hump when that sugar solution gets to the colon, and that is normal colonic fermentation. So the 90-minute mark is where most labs are going to do a cutoff. There is research that suggests that the cutoff for lactulose specifically needs to be more like 60 minutes rather than 90 minutes. And that's why, in my opinion, this one would not classify as SIBO. And I told my patient that. But you could see a nice hump when it gets to the colon, which we would expect with lactulose. Then you can see here the CH4, that is methane gas, stays well below the 10 parts per million line, and the hydrogen sulfide gas stays well below the 5 parts per million line. So this is a really nice example of a very clear negative SIBO breath test. Now, let's get into some other variations. Oh, hold on. If I can open the PDF, that'd be swell. There we go. Okay, so here's another one. And we'll go ahead and zoom in just a little bit. Now again, the first thing you want to look at is the sugar solution. So this is a lactulose test. So again, lactulose is going to speed up transit time by a fair amount. So really we want to use a cutoff probably more like 60 or 75 minutes rather than 90 minutes. You could see down here, you just do a quick skim and it looks like that was a mixture of scam and skim for some reason. Anyway, you could see that they have a quantifiable number for each and every one of those samples. So there's no invalid samples. All of them were collected successfully. And then you can see here that the interpretation is indicative of intestinal methanogenic overgrowth and excessive hydrogen sulfide. You notice that they don't actually say SIBO, right? They don't say small intestinal overgrowth necessarily. And you can see they give you a quick glance interpretation of which two are abnormal, and it looks like hydrogen, is normal, and methane and hydrogen sulfide are abnormal. So let's scroll on and we'll find out more about this sample. Yet again, here's a really nice, clear, negative SIBO breath test from the hydrogen perspective. You can see that hydrogen doesn't even cross the threshold until after the 90-minute mark, and it's nowhere near it here. You can see that they put the dotted line for the H2S or the H2 cutoff up closer to 25 parts per million. And I've observed that with this particular lab is that they kind of play with their ranges a little bit. So one day I'll order this and it's 20 parts per million, and the next it's 24.56, which is very peculiar. But you could see generally similar, and it's not even getting close to that threshold here. So that is clearly negative. Then we get to these. Now, you can see that this is well above the 10 parts per million range, but if you notice, there's no discernible noteworthy dip or rise in the small intestinal territory. So you kind of ping pong from like 30-ish to 35-ish, 35 down again to 30, and it just kind of has this little smooth hump under here, this area under the curve. That is not enough to reach the diagnosis of methane SIBO, or CMO, if you will. Rather, you would need a rise in 10 parts per million sometime between 0 and 90 minutes, and we don't get that. We only get a rise of about 5 parts per million right here in this little hump. Rather, this is an elevated baseline methane that stays elevated, and this is probably a case where somebody either has done inadequate prep for the test. Maybe they didn't do the full prep diet, or they still have some food and fiber residue in their colon, and this is more indicative of colonic methane overgrowth rather than small intestinal overgrowth. Because you can see, again, there's nothing happening between the 0 and the 90-minute mark that makes us compelled to say that this is methane SIBO. In order to have methane SIBO, we would have to have a situation like this. We would have to have that peak somewhere in that 90-minute mark, and it would need to be more than 10 parts per million. So I would agree with the lab here. It's indicative of methane overgrowth or methane overproduction, but it's not localized to the small bowel. Now, down here, you can see this is very similar. They have an elevated hydrogen sulfide number, and then it steadily decreases throughout the duration of the test. So similarly, this is not hydrogen sulfide SIBO. And this is one of the very few beefs that I have with this company, is that in their educational materials and in their webinars, they have said, and I've reached out and asked this, they will tell you that any elevated hydrogen sulfide is hydrogen sulfide SIBO, and I vehemently, strongly disagree. There's nothing happening. There's no rise between the 0 and 90-minute mark that makes us think small intestine. Rather, it's an elevated baseline that gradually gets better, but this is going to be coming from somewhere else, probably the colon or possibly the mouth, but not the small intestine. This is not H2S SIBO. So that, that's a bit frustrating, but that is what the lab would tell you. And then what's worthy of knowing is that I'm trying to word this in the kindest way possible. Clinicians will usually default to asking the lab for the lab's interpretation, and they may or may not use the most stellar critical thinking skills to interpret it on their own. Or if that clinician is kind of new to the SIBO world, they might not know how to interpret this. So what I'm finding is that a lot of people are probably getting this test and being told they have hydrogen sulfide SIBO, when in actuality they don't. They have hydrogen sulfide overgrowth that is localized somewhere other than the small intestine. The whole point of doing this test is to try to capture a peak in breath gases between the 0 and 90-minute mark. That's the entire point of doing the breath test. So we cannot claim that this is coming from the small bowel. We are effectively ruling out hydrogen sulfide small intestinal bacterial overgrowth. This is coming from somewhere else. Let's go ahead and look at another example. Likewise, we'll go through the same process. We'll see that this is a lactose-based test again. We'll take a quick glance, and they're saying that this is abnormal for hydrogen sulfide. Again, you'll notice here on the interpretation that it is indicative of excess hydrogen sulfide. They don't actually say SIBO here. They're kind of skirting around that. And then take a quick glance down here again, and you can see that there is a quantifiable number for each of these samples, so it looks like there's no invalid samples. We go ahead and scroll down, and then we've got another weird hydrogen cutoff. Look, the cutoff this time is 56.13. Lord knows why. Lord knows why. But nonetheless, we can glance at that, and apparently they're deeming that as normal for whatever reason. Now, I will say, if you look at the peak, we go from, well, let's actually just look. Let's see, about the 45-minute mark, the hydrogen goes from 15-ish to 35-ish. So that would actually classify as SIBO if we were using the other ranges. And let's see what the date on this was. This was late 2020. I think that the lab was still kind of adjusting their ranges. If we use the more established 20 part per million range for hydrogen, then this would actually be barely positive for SIBO for hydrogen purposes. So that's worthy of knowing. For some reason, they had their cutoff way the heck up here. I don't know why. But you can see that we do get a peak, and there is a quantifiable number. Now, if this happened and it went from this number here down to 0 and then back up, I would wonder if it was an invalid sample. And we're going to see examples of that in future parts of this video. But you can see that this is actually a quantifiable number. It's about 15, and then it jumps up to 35, and it's before the 60-minute mark or right at the 60-minute mark. So even with lactulose, I'm thinking that this person has SIBO. Then you can see methane is nada mucho, so that's fine. And then we see another good example of an elevated hydrogen sulfide baseline, and it persists and is high throughout the whole test. It takes a little tiny dip at the 90-minute mark, and then it goes right back up. This is colonic hydrogen sulfide overgrowth, if I ever did see it. This is not going to be small intestinal bacterial overgrowth with hydrogen sulfide necessarily. But here's the thing that I also will point out. If you look here, notice the numbers for hydrogen sulfide, 10.0, 10.0, 10.0, 10.0, 10.0, 10.0. It's entirely possible that the top end of their range that their equipment is able to detect is 10.0. So it is possible that this person went from, let's just play around with it. Let's say this person went from 10.0 to 12 to 15 to 16, down to 12, down to 10. It is possible that this person had a peak of hydrogen sulfide somewhere in this range, because it looks like, if I had to guess, it's pretty suspicious that they had that many perfect 10.0s. So I think they're probably only able to detect hydrogen sulfide accurately up to 10.00. and anything beyond that, they're just flagging as 10.00. But as far as we're aware, looking at the graph that they give us, this would not be intrinsically indicative of hydrogen sulfide overgrowth in the small intestine. This looks like, bare minimum, it's hydrogen sulfide overgrowth in the colon, or dysbiosis in the colon, but we can't really ascertain whether it's truly H2S SIBO based on this test. But like I said, this person would classify or qualify for the hydrogen SIBO diagnosis, in my opinion. Let's see, next up. I've got a bunch in here. This runs the risk of being a very long video. FYI. All right, here's another one. Again, we're going to glance. It is a lactose-based test, so that is going to speed up transit time, and we probably want to use more of a 60-minute mark for SIBO criteria. It looks like hydrogen sulfide is what is abnormal, and it looks like there's a quantifiable number for each and every one of these samples, so there's no invalid samples. Scrolling down, we can see this is clearly a negative SIBO breath test from the standpoint of hydrogen. So you can see that we start to get a little bit of a rise, but we don't get up to that 20 or 25-minute peak until well after the 90-minute mark, and then you can see a climb after that. So this is the beginning of the colonic fermentation. This 90-minute mark result is probably also the beginning of colonic fermentation of the sugar, rather than like the terminal part of the ileum, the terminal part of the small intestine. So this is clearly a negative SIBO breath test from hydrogen. Negative methane breath test as well. This is a nice, pretty much flat line for methane. And then here we have yet another elevated baseline for hydrogen sulfide, and then it goes down, it goes down, it goes down, and it kind of peters out a little bit, but it is still higher than 5 parts per million throughout the entire test. Now again, let's look up here to the top. It says it's indicative of excess hydrogen sulfide. It says the observed peak for hydrogen must be within 90 minutes. Again, with lactulose, I would argue 90, or I'm sorry, I would argue 60. But they don't actually say anything about SIBO specifically, thankfully. But again, if you talk to the lab, their interpretation would be hydrogen sulfide SIBO, which I really disagree with. This is, again, going to come from the colon, maybe the mouth. It's not coming from the small bowel. We have nothing to support the notion that this is coming from the small bowel specifically. Onward we go. All right, here's another test. This is a glucose test, so we don't have to worry about speeding up the transit time. So that is a good consideration to take into consideration. We have a quantifiable number for all of the gases, or at least 2 of the gases on these samples. So we know that all of these are valid samples. And we can see yet again, it's saying that this is indicative of excess hydrogen sulfide. So let's take a look. Here's another good example of clearly a negative SIBO breath test from the stance of hydrogen. You can see there's little blubs here or there, but it never really gets above 10 or 11, so that is clearly negative. We have a nice flat line for methane production, and then yet again, we have an elevated baseline, and then we get just the littlest of a peak here, and then it goes down, and then we're actually getting a little bit of a double peak scenario. So for those of you who don't know some of the intricacies here, with lactulose specifically, we might expect a double peak because we could have a peak in the fermentation coming from the small bowel and then another peak coming from the colon. But if we scroll back up, remember this is glucose. So that is not necessarily necessary for the interpretation of a glucose test. We would not expect the glucose to reach the colon much at all. And yet you can see we actually have a little bit of fermentation apparently reaching or a little bit of the sugar and thus fermentation in the territory of when we would reach the colon, which is very suspect. Glucose should be absorbed by the first part of the small intestine, so really it shouldn't be making it far beyond that. So this is going to be keeping in line, like if you think about it, we have an elevated baseline, which again is probably coming from the colon, or maybe the mouth, or maybe, esophagus, stomach, somewhere else, but it's not coming from the small intestine. And you can see that we still have a lingering amount of hydrogen sulfide even well after all the glucose has disappeared from the bowel. There's no way on planet Earth that a bunch of glucose is reaching the small bowel at the 120-minute mark. This is all part of that elevated baseline. Now, if you look, This particular person goes from 8 to 10, so maybe they have the littlest smidgen of hydrogen sulfide overgrowth. Well, I wouldn't even say we can call it overgrowth. We can say there's some hydrogen sulfide producers that are maybe present in the small bowel, because we do get that little blip, but it's not enough to land you the diagnosis of hydrogen sulfide SIBO. So let's go ahead and check out yet another one. All right, quick glance. It's a lactulose test, and there are valid numbers for all of the results, so we can move on. Here we have another clearly negative hydrogen-based test up top. You can see that we don't get any sort of a peak until we get well into the colon territory here. Likewise, methane is nice and low. And then yet again, we have another great example of an elevated hydrogen sulfide baseline. And then it stays persistently high, although it wobbles a little bit. It stays persistently high throughout the entire duration of the test. Now again, let's look at sample number 3 and sample number 5. You can see that hydrogen sulfide in this case goes from 7.1 up to 9.87. So we're climbing up maybe a little bit shy of 3 parts per million. So again, you could say that maybe there's a bit of a presence of a hydrogen sulfide producer in the small intestine. But again, the difference between the low point and the high point is not crossing that 5 part per million threshold. So technically speaking, this would not get the diagnosis of SIBO. Yet another one. Like I said, this risks being a very long video. Here we have a glucose-based test. We could see, we have our first official invalid sample right here. So we need to know that when we're looking at the rest of the test. We have an invalid sample for number 3. So keep that in mind as we go, but it looks like all the other samples are good. Here we have a nice, what looks like a so-called flat line, or close to a flat line for hydrogen. And this used to be thought of as potentially indicative of hydrogen sulfide overgrowth. I have not necessarily seen that to be the case. And you've seen examples now with this particular test where we're officially looking at hydrogen sulfide. So I would not take this to be a hydrogen sulfide producer necessarily. And then look what we have here. At first glance, if you're not careful, you would see this and you would think, whoa, the peak, the difference goes from here to here, from 0 to 10. That's clearly hydrogen sulfide SIBO. But remember, we're looking at 1, 2, 3. The third sample was invalid. So most likely the line would actually look like this. And that's probably the line that we're really looking at. We have to take into account that anything below there is questionable because we don't have that third data point. So you need to just omit that from your brain and follow this line and go, all right, we start off high, maybe we get a little bit of a bump. So let's look at the difference between sample number 4 and sample number 5 and see what the difference is there. And then similarly, we can see that this person had high methane. So again, methane overproduction, certainly. And then it goes down. And then similarly, we have to omit the third sample. So probably the line is going to look a bit more like this. So similarly, this is not indicative of methane SIBO, or CMO rather, but this is an elevated baseline methane. So this person probably has methanogen overgrowth or dysbiosis in the colon, and that could certainly be leading to constipation, possibly bloating. But this is not hydrogen sulfide or methane SIBO necessarily. But let's take a look at samples number 4 and samples number 5. So sample number 4, the hydrogen sulfide goes from 7.81, and then sample number 5, 10.00. Now again, remember that it appears that this lab is only able to measure up to 10.00. So truthfully, this could be hydrogen sulfide SIBO, but at first glance, it doesn't look like it. If we're really believing that it goes from 7.81 to 10.00, this would not classify as SIBO for hydrogen sulfide. But if we're thinking, well, that's just the cap of where they can measure stuff, for hydrogen sulfide rather, so maybe it went from 7.81 up to 22.32. Like, we don't know. So this is a patient, I remember her sample. I told her I do think she has SIBO. I just think that we've reached the cutoff point where the lab is able to measure hydrogen sulfide. And I think that if we had a little bit more wiggle room going up, I kind of think that she truly has SIBO. And a lot of her symptoms made sense for SIBO. And keep in mind, too, that, like I said, glucose is going to be a little bit better than lactulose for the false negatives, false positives thing. But you're still going to get a lot of false negatives and positives with any sort of SIBO breath testing. And that's just the way the cookie crumbles, unfortunately. Next up, we have another glucose test. So again, we don't need to worry about the speeding up of the transit time. You can see that they're flagging methane and hydrogen sulfide as abnormal. You can see here they're starting to give, they say, indicative of intestinal methanogenic overgrowth and excessive hydrogen sulfide. So they're starting to hint a little bit more at SIBO, although they're not calling it SIBO. And at first glance, it looks like all of the samples are valid, so we can continue with our analysis. We have a nice, this would be truly a flatline hydrogen test. This is what we're talking about when we're talking about a flatline. There's really hardly any hydrogen at all. And you can see one of the reasons why. So hydrogen, you'll notice the chemistry of it all. So H2 can get made, if you slap two of those bad boys on a carbon, it can get made into methane, and that's exactly what the methane producers are doing. And similarly, if you take one H2 and slap it on a sulfur, you can get hydrogen sulfide. And that's exactly what the H2S producers are doing. So keep that in mind, and that's why we were thinking for a while there that a flatline H2 breath test could be indicative of an overgrowth of one of the other two gases. And it looks like certainly the baseline is high. This doesn't necessarily meet the criteria for SIBO, although let's look. So let's see. So we get a high methane baseline again, and then we get a dip down to about 20, and then we do go up close to 30. So let's see what the difference here is. All right, so yep, 19.92 for sample number 2 for methane, and then we jump up to 29.66. So it's technically speaking, it's just shy of the 10 part per million number, but I would personally call this methane SIMO, not SIBO because it's not bacteria, but I would call this SIMO because we do get a jump in the small intestine territory well before, well before the 90-minute mark. We get that jump, and it is right about 10 parts per million. So that does meet diagnostic criteria for methane overgrowth, as well as SIMO, small intestinal methanogen overgrowth. Now, on the contrary, and this could be where all of the hydrogen gas is going, by the way, because again, your methane producers are going to take the hydrogen gas and make it into CH4, methane. On the other hand, we see another elevated baseline for hydrogen sulfide, and then it kind of peters out and it stays high the entire time. And the difference between the lowest point and the highest point, other than baseline, is not greater than 10 parts per million. And that does not happen anytime between the 0 and 90-minute mark. So there is no indication of hydrogen sulfide SIBO, but this person is struggling with excessive hydrogen sulfide production. Again, I'm going to be a broken record, but it's probably local to the colon or maybe the mouth. But I would argue probably this is going to be a picture where the colon is churning out hydrogen sulfide gas. And it's possible that even if the person did good prep, they probably have some remnant, fibers and foodstuffs hanging out in the colon, and that's what the bacteria are munching on. So that is that story. Let's see. Okay, if I could just, there we go. Okay, yet another one. All right, this is a glucose test, and we can see no invalid samples, so we're going to march on. Clear as day. This is SIBO if I ever did see one. Look at this bad boy. We go from 10, and then we jump all the way up to about 35, and then we come back down to 30, and then we gradually peter out. This is a very classic case of SIBO, and this is a case where probably the SIBO is very high up. Like I'm talking duodenum or maybe the upper part of the jejunum. This is right up high in the system, and it's probably pretty severe. Now, there is something to be said for the severity of symptoms correlating with the severity of methane overgrowth. Like the more methane you have, the more constipated you will be. This, I'm saying, is probably severe not because of the quantity of hydrogen, but because it's right there just on the other side of the stomach, and then it peters out. I tend to think that this is the more profound case of poor motility and SIBO, as opposed to somebody who like barely squeaks by the diagnostic criteria right before the 90-minute mark, and it's at least the bacteria is closer to the colon, and we can get the MMC to fire up and the vagus nerve to do its job, and we can just kind of sweep that last little bit of bacteria into the colon. This person's got a lot of work to do before any of this bacteria gets swept down to the colon. And then we can see the other two gases. Methane is virtually non-existent, so that's clearly negative. And then you can see yet again, this one's kind of questionable because we go from basically, let's see, that looks like 4.5 or maybe 5 up to looks like about 7, and then it goes down, and then we get a little bit of a peak again right around the 90-minute mark. So this, I would say, this person definitely has hydrogen overgrowth and questionable hydrogen sulfide involvement for this particular case of SIBO. You can see that they clearly have an overproduction of hydrogen sulfide, but I'm starting to think that this might be a twofer. But I will also point out, look at the graphs and tell me what you notice. Well, you can't because I'm recording a video. Notice that the peak for hydrogen actually correlates with the peak for hydrogen sulfide. So what we used to think of like, oh, if we have a flat line hydrogen, then that will correlate with the hydrogen sulfide production because the hydrogen sulfide producers are consuming the hydrogen. At least for this person, the two peaks actually correlated with one another. So I don't really think that the flatline SIBO breath test can tell us as much about hydrogen sulfide as we might have thought it could. Another one, we've got a couple more guys. This is another lactulose-based test, so we need to keep in mind that that's going to speed up the transit time. At first glance, it looks like they're pegging this as an abnormal hydrogen peak. It looks like all the samples are valid, so we get to march on. And yeah, I would say that this is questionable hydrogen SIBO. And the reason I say that is, again, because this is a lactulose-based test. And lactulose, there is some research that suggests that our cutoff for lactulose-based testing might need to be the 60-minute mark as opposed to the 90-minute mark. So for this, clearly if we're using the 90-minute mark, clearly this meets diagnostic criteria. You can see that they're crossing that threshold of 20 parts per million somewhere between 75 and 90 minutes. So if we're using the 90-minute cutoff, yes, this would be a case of SIBO. But you can also see that it goes really quite beautifully with this nice little curve when it gets to the colon. So I would honestly think that this is probably colonic fermentation, and it's just that the lactulose sped up the transit time a bit, and therefore we're starting to capture the tail end of colonic fermentation. So I would actually say this is probably a negative SIBO breath test. But again, depending where you're at, especially if you're in the United States and you're using lactulose, some clinicians might not keep that in mind, and they might tell you that you have SIBO when in actuality you don't. Then let's go ahead and scroll down. Methane is nice and low. That's basically a flat line. And then yet again, we could see an elevated hydrogen sulfide baseline, and then it gradually goes down over time, but it stays pretty elevated. It goes only from about 5 to maybe like 3.75 at the end. So this is, again, I would say this is hydrogen sulfide colonic dysbiosis more than likely, or maybe oral dysbiosis. There was a study here, and I'll kind of drag it over to my window. The guy who is oftentimes known as the probiotic advisor, his group did this recent study, this was January 2021, where they said hydrogen methane breath testing results are influenced by the oral hygiene. And they basically showed that if you have patients collect their SIBO breath tests, but you administer a mouthwash before each sample, it significantly reduces the breath hydrogen and the breath methane and it makes the results much easier to interpret. So I'm probably going to adopt something like this and have my patients use mouthwash prior to collecting their samples, because any sort of funky breath, any sort of funky bacteria in your mouth could actually be producing enough hydrogen or methane or hydrogen sulfide to throw off the diagnostic criteria for this test. So that might be why we see so many elevated baselines with the SIBO testing. I mean, you've seen it, and practically everybody has an elevated baseline. But again, the problem is if you talk to the lab, and therefore if your doctor talked to this lab, they would, at least last I knew, they were telling clinicians that that is H2S SIBO, and that really, really irks me. That is not at all the case. All right, another one. Okay, this is a lactulose test. So again, we have to keep in mind that speeds up transit time. It looks like there are no invalid samples, and it looks like, oh my, this person must have quite the case of hydrogen. Let's find out more. This is a tricky one. All right, like let's look at the 60-minute mark. Let's look at the difference between 0 and 60 minutes and see if that crosses the 20 part per million mark. Let's take a look-see. All right, so this person started out with a baseline of 15.98. Let's just call it 16. And then they climbed and climbed and climbed. And then at the 60-minute mark, they got up to 44.80. Let's just call it 45. So this was going to be right on the cusp for me. But if I use the 20 part per million mark for hydrogen, I would call this hydrogen SIBO. It looks like, again, you get about a 30 part per million rise between baseline and the 60-minute mark. And 60 minutes is right about where we need to be if we're using lactulose, which we are. And you can see it does look like the fermentation accelerates between 45 and 60 minutes. You can see the slope of the curve does change in that period of time. And then it looks like possibly starting at 45 minutes and then going up, 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 it looks like we're starting to capture the beginning of colonic fermentation. So let's also look at the difference between 0 and 45. Does that reach the criteria? So we go from, again, basically 16 up to about 30. So it's right on the cusp. It would be right around 14 or 15 parts per million difference. So this one's dicey. I would probably treat this person assuming SIBO, but I wouldn't go super aggressively. This would not be a case where I would say like, yeah, do rifaximin, kill it with antibiotics, because we truly are on the fence. It looks like you start to get a little bit of a petering out here. It looks like they kind of crescendo at the 45-minute mark, and then we get a steeper rise, because I'm guessing we're starting to hit the beginning of colonic fermentation, if I had to guess. Because if you look at the slope of the curve, the slope from here to here is very smooth and consistent versus the slope from here to here and then the slope from here to here. So it looks like we had an initial rise in the first couple of samples. We have an initial rise up to 30, and then we kind of even out and we have a little bit of a plateau, and then we have another pretty marked increase. But with lactulose, I'm assuming that the majority of this is coming from the colon. I would probably be prudent, and I would treat this person as though they have SIBO, but I would let them know that this is not a case where I think that antibiotics are necessary. I think we probably just need to ensure that they have really good motility and a really healthy, happy microbiome and a really diverse diet. And then maybe we'll do some antimicrobial herbs, but I'm not going to pound the snot out of them with antimicrobial herbs even, because I don't think it's necessary. And then here, my God, this is probably the first case that we've gone over where we don't have an elevated hydrogen sulfide baseline. I'll be damned. It does happen. And you can see that methane is also nice and low. So that was a great example to see it as well. And then let's go over 2 more examples. So here we have another lactulose test. Again, I see a lot of people with yeast and blood sugar issues, and I'm just so cautious to do glucose with those folks. So I do use lactulose a lot, even though it's less accurate. But you could see lactulose, so we have to keep in mind the whole transit thing. This one says gases detected at normal levels, so that's cool. All right, go you. But also, if you look down here, samples 1 and samples 2 are invalid. So the person, for whatever reason, did not collect their gases super, super well for the baseline samples. So let's take a look at what that looks like. And yeah, you can see, so we go from 0 to 0, and then we go up, and then we can see that even if we treat this number as the new baseline, it doesn't do anything. It really doesn't climb until we get well into the colon territory. Similarly, we get a little tiny blip here, but really that's nothing to write home about. And similarly, this person probably would have had a hydrogen sulfide baseline somewhere around 2 or 3. And then the curve, had we not had those invalid samples, the curve probably would have looked more like this, as opposed to what we're seeing here. But you've got to keep an eye out for those invalid samples. Those are really going to throw you for a loop. And sometimes, honestly, even for me, I'll take a glance and I'll see something and I'll be like, oh man, that's SIBO. And then I have to take a double take and I have to look at it again. All right, last one. This is another Lactulose test. You can see, this one's going to be a little squirrely to interpret. You can see that sample number 3 is invalid and sample number 6 is invalid. Now, sample number 6 is at the 85-minute mark, and since we're testing with lactulose, that probably doesn't really matter. But sample number 3 at the 40-minute mark, sure as heck is going to matter to us. So let's go find out what this graph is going to look like. So sample number 3, 40 minutes is invalid. All right. And this gets very confusing. So again, what you kind of need to do is you almost need to draw a new curve. And you need to assume, all right, hydrogen is probably doing that. And then similarly, you know, at the 80-something minute mark, we're not really caring about it because this is lactulose. So even if we think, all right, we have 10 for a baseline, and then we're going up, right about at the 60-minute mark, it looks like we are going to cross that threshold. So let's compare the difference between sample number 2 and sample number 4. And I think that's going to tell us what we want to know. All right, sample number 2 goes up to 6.62, and then this person climbs up to a whopping 41.19. And this is in the territory where I would still consider it a possibility that we're looking at small intestine fermentation. It's right before the 60-minute mark, and there have been studies that lactulose can speed up transit profoundly. And it could be that we're looking at colonic fermentation, but again, I'm going to be a little bit more cautious and probably chalk this up to SIBO. So let's see. So the difference between 6, let's say 6.5 and 41, sure as heck is going to pass that diagnostic criteria of 20. Again, God knows why they keep changing this, but 20 parts per million for hydrogen is pretty well accepted. So I would consider this to be a probable case of hydrogen SIBO. And then I would just ignore everything past, past this cutoff right here. Because again, we're looking at lactulose, so we're going to speed up transit time. And by the time we reach even this what would this be, like a 70-minute collection, we're probably hitting colon fermentation by this point. So this is another case where, because it's right on the cusp of being in that 60-minute territory, I would really focus more on microbial diversity and dietary diversity, making sure that motility is working real well, making sure that this person is not inflamed and they have some vagus nerve action going. And I would maybe do a little bit of light antimicrobial work, but this is not a case where I would pound the snot out of somebody with antimicrobials. And this is not a case where I would do prescription antibiotics. Even if I did prescribe, I would not do that. So that's what I would say for that. For methane and hydrogen sulfide, again, it looks really compelling at first glance, but remember the curve probably looks like this for methane, and it probably looks like this for hydrogen sulfide, because again, we have 2 invalid samples here and here. So this is another example of somebody who has clearly a high hydrogen sulfide baseline, and that isn't going to do them any favors. I mean, hydrogen sulfide is not going to do you a great deal of good, no matter where it's located. So we want to work on that hydrogen sulfide dysbiosis in the colon, but this is not hydrogen sulfide SIBO. But at first glance, you might be tempted to say that because you go, oh, look, this person goes from 0 up to like 8. That's hydrogen sulfide SIBO. So please, please, please make sure that you look for invalid samples, because they do happen. We've seen a couple examples here today, and you have to just ignore those invalid samples and kind of draw your own graph, ignoring those two samples, and assume that you're connecting the dots without those plots. But this is a person, like I said, I do think that I would treat this as hydrogen SIBO, but not hydrogen sulfide SIBO. So all things said and done, guys, I really like this test. I think it's a really useful test, and I'm glad that we are trying to assess for hydrogen sulfide. It's just that this is potentially going to over-diagnose a lot of people with hydrogen sulfide SIBO who in fact do not. I think there's a high prevalence of hydrogen sulfide colon dysbiosis, but not nearly as much hydrogen sulfide SIBO as we previously thought. So by all means, treat hydrogen sulfide local to the colon, but please don't do the low FODMAP diet and think that you need to treat SIBO aggressively because of something on this test, unless you go through it and you really make a point to interpret it correctly. So I hope that this was helpful for you. I definitely am a fan of this test, but there needs to be some really careful thought and consideration when you're interpreting it, and please double check your clinicians. Again, a lot of them either are not super familiar with SIBO, or they're just going to listen to the lab's interpretation and run with it. And I think that you really want to double check that you're getting the proper interpretation of this type of a test, certainly before you do prescription antibiotics, but also before you embark on round after round of oregano or berberine or whatever it might be. Please, please, please make sure that this was interpreted correctly, and make sure that you get the appropriate diagnosis before you go in guns a-blazing and potentially really wreck your microbiome. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.